There is one caveat, and you're going to be hearing this a lot from me in regard to capital projects in the years ahead. We're going to insist on one condition. The Partnerships BC take a hard look at how that project might be built as a public-private partnership.
Richard Neal, who is a former insurance underwriter who specialized in risk analysis, and he is now a researcher with the BC Health Coalition focusing on healthcare economics and the public-private partnerships. He's researched and written on the topic of healthcare P3s in the United Kingdom and in Canada. So I'd like to welcome all three of you here. Thank you very much for coming.
There are many problems that I feel are associated with P3s or public-private partnerships. I'll tell you a couple of them right off the bat. The first thing is they're about as much fun as watching paint dry. They are complex, abstract, financial and legal contracts that stretch 30, 40, 50 years into the future. The second problem we find is that P3s or public-private partnerships is a euphemism for the privatisation of what would otherwise be a very unpopular move. Our governments and certain industry bodies have to call these long-term contracts partnerships. But we should remember they're just a long-term contract to finance, design, build and operate public infrastructure, usually for a very long time, 30 years plus. Whether it's a road, whether it's a hospital, whether it's a school, whether it's a community centre, these contracts are all driven through under the guise of a partnership. What I would suggest to you is adopt a sceptical tone and adopt a sceptical approach when you hear these euphemisms like partnerships. I think with P3s we see several problems that are emerging from other jurisdictions that have used P3s for healthcare infrastructure. The first is increased costs. The second is a complete lack of public accountability. And the third big problem, in my opinion, is that the increased costs associated with P3s tend to divert money away from community patient care, from bedside patient care, from long-term care for our patients, into unnecessarily expensive administrative and financing costs. Now, the original justifications for P3s were that with private sector innovation, efficiency and private sector expertise, they would let our hospitals, our schools, our roads be built on time, on budget. Now, that is an absolute godsend to our public officials, who are both elected officials and appointed officials. Every politician, every public servant is petrified of having the sort of cost escalation and project creep splashed all over the front page of the Vancouver Sun. It does them a terrible amount of damage politically. And so, under public-private partnerships, a consortium of private companies come together and they promise our public servants that they will build any given piece of infrastructure on time and on budget. They also say that they will operate it efficiently for 30 years. The idea behind that is that with the private sector efficiencies, if the contractors, the consortiums, don't deliver on time and on budget and don't deliver the required level of services, they won't get paid. When you look at it initially, that sounds like a fantastic deal. Is it? Is it too good to be true? That's where we should adopt an evidence-based approach to P3 contracts, the same approach that you would take if you were buying a used car from a second-hand car dealer. Don't believe necessarily what the car dealer's saying. Check for yourself.
In fact, I can tell you today that we're going to be making that a condition of provincially funded capital projects as over $20 million in the future. We know P3s save money, transfer risk, and add great value through design innovations and private sector ingenuity.
You'll see lots of claims made about public-private partnerships. Some from the UK saying that they've been shown to save 17% of costs over the course of a 30-year contract. Well, you'll hear about this in a couple of minutes. Those savings are less than definitive, and they haven't occurred yet. and they're certainly not cash savings that are going to occur over the next 30 years or so. So far, both in the UK and in Canada, there's been no evidence of publicly available quantitative studies that confirm lower costs for P3s. What that means is there's no hard objective evidence that you can check for yourself that P3s cost less. But why do P3s cost more? Well, to look at that, we have to look at the structure of a P3 contract. Traditionally, the government would raise money to build a hospital extension for Surrey Memorial, for instance. It could do that via a couple of ways. It could borrow money, or it could get money via ongoing tax revenue. Now, with a P3, instead of the government borrowing directly, it asks a consortia, a group of companies, to do the borrowing for them, and then design, finance, build, and operate large parts of the facility that they're involved in. What's the problem with that? Well, the problem is that the costs of borrowing for any private sector organisation are far higher than, for instance, our provincial government could secure. Why? Well, governments never go bankrupt. They are very attractive for international investors and bond investors over the course of 20 or 30 years. They always have ongoing tax revenue. They can always pay their debts, and as such, they're the lowest risk borrower in the markets. The lowest risk borrower in the markets generally get the lowest interest rates. So if you're going to borrow $130 million to build the extension to Surrey Memorial Hospital, who do you want doing it? The government, who can secure the money for this at a far lower rate, or a private sector consortia? Problems are with the private sector consortia, we know that their cost of borrowing is anywhere between 15 to 40% higher. The P3 contract is essentially a lease of 30 plus years. Those higher interest costs have to be paid over the 30 years. The full costs aren't apparent up front because payments are structured over a period of decades. It's a buy now, pay later scheme. And as with most buy now, pay later schemes, as you suspect, the costs in the long run will be far higher. In addition to higher borrowing costs, P3 consortia also have to pay other expenses that get added on to our bill in these payment streams over the next 30 years. They have to pay for things like security filings requirements, insurance, takeover defence strategies, marketing, much higher proportionately administrative costs, and they also have to pay, according to our capital asset management framework, they also have to be able to receive about 12 to 18% year dividends or profits. All of these combine, and they combine to add up to a higher cost long-term debt. And for that higher cost long-term debt, the P3 consortia builds our hospitals nominally on time and nominally on budget, but then has the right to operate large parts of them for the lifespan of the facility, starting at 30 years, going onwards. Now, with the Surrey Memorial P3 that our government is trying to implement, the P3 consortia at the moment is not going to be looking after the nurses, the doctors, and employing the nurses and doctors there. Probably Deb and Barry can speak about that a little bit later. What they will be doing is employing and directing the hospital support staff for cleaning, for laundry, for maintenance, for all sorts of operations. Why is that a problem for healthcare? Well, it's because in any given facility, there is always a clinical interface between bedside patient care and the physical infrastructure that you're in. Whether it's a light bulb, whether it's clean linens, whether it's food, whether it's laundry, whether it's any of the services that go on and are associated with any sort of healthcare facility.